Hello and welcome to the Eastern Psych course. I'm Seshni Mudlia and this is the tutorial for the link station of the post-myocardial infarct depression. So the instruction to the candidate is, you've seen Mr. Nicholas, a 45-year-old gentleman who's been diagnosed with a post-myocardial infarct and now a moderate depressive illness. Speak to the consultant psychiatrist on call. So the task for the candidate is to discuss the management and diagnosis of the patient with a post-myocardial infarct depressive disorder. So candidates, the checklist here and the bullet points which I want you to bear in mind and also to write down are the following 5 factors. Firstly and foremostly, you want to give the consultant a psychiatric formulation of this patient. Secondly, you want to highlight the capacity issues. Thirdly, you want to explain what your possible differential diagnosis would be. Fourth would be to explain your management of a patient with a post-myocardial depression using a biopsychosocial approach. And 5, you want to highlight the risk issues of a patient with an MI and depressive disorder and stress the importance for therapeutic alliance. So we will go through each step by step and systematically in the next few minutes in order for you to master the techniques of this station. The communication skills here that are required are that you need to know that you are speaking to a consultant, so you need to tailor the information of that towards a fellow colleague and adopt a collegiate approach. So the introduction or suggested approach would be an example like this. Hello, I'm Dr. Mudlia. I've just seen a young gentleman in the cardiology ward who was referred following a myocardial infarct and a diagnosis of a moderate depressive disorder. I would like to discuss this case further in terms of my diagnosis and management plan. So once you've established rapport with the consultant, which I'm hoping would be easy to do, you would then proceed to the first bullet point, which is giving a psychiatric formulation. Candidates, the format for this psychiatric formulation we will go through in detail, and the reason is that this is a station where once you've got the good structure of doing a psychiatric formulation, you can be assured that you can tailor the structure which you have to all the other stations which are similar to this. That is, for any other station where you have to do a management and speak to a consultant colleague. So it is important for you to develop the structure, and if any of you have done the old Part 2 exam or the PMPs, you would realize that actually the management station like this is actually a PMP disguised in a CASC form. So all the essential information that you would have given in a PMP is what exactly you would need to deliver in this station. So the initial step for the psychiatric formulation is, A, you would need to give some demographic details For example, you would say, Mr. Nicholas is a 45-year-old teacher who's married with 2 children, and he's recently suffered a heart attack 4 weeks ago. He's now presenting with features of a depressive disorder, and he lacks motivation to continue to engage with the cardiac rehabilitation program. So this would give the consultant a good synopsis or summary of the patient that you are about to discuss. Next, you would want to move on to highlighting any relevant past psychiatric history and other history which is relevant. So you want to go through it systematically as if you've taken a full history. You want to highlight the bits from the personal history, past psychiatric history, family history, drug and alcohol history, social history, forensic history, and any other history that might be relevant. Medication history and physical health or medical history and medication. So once you've established that, you will then move smoothly on to giving the consultant the next point C, which would be the mental state formulation. So you would want to highlight the features of the depressive illness which you have found in this patient. So highlighting the core features of low mood, anhedonia and energy, and also the presence or absence of suicidal ideation, intent or plans. Thereafter, you want to then highlight the current risk factors that he's presenting with and the risk assessment. For example, you would highlight that he's presenting with a moderate depressive disorder and that he suffered a myocardial infarct, and the current risk factors for myocardial infarct in his case are the following. They could be 1, that he's leading a sedentary lifestyle, 2, overweight, 3, high cholesterol, 4, smoking, 5, alcohol, 6, any level of any stressful factors that could also be contributing to this. So once you've established that, you would then move on smoothly to highlighting what the capacity issues are, which is the second bullet point. So in the capacity, this is important because you want to explain to the consultant whether you think that Mr. Nicholas has capacity to make the decisions about his current treatment, and if not, you would need to substantiate that. So for example, you could say, I did assess Mr. Nicholas's capacity around his attitude towards his myocardial infarct and also his depressive illness. I looked specifically at whether he was able to understand what the current illnesses and the management of these illnesses were, whether he was able to weigh the pros and cons of engaging with the treatment and the consequences of not engaging, whether he was able to communicate this decision to me. In my opinion, I think Mr. Nicholas does not have the capacity to make these decisions and lacks motivation to make these decisions, and also to engage with the cardiac rehabilitation program. And the reason is that this is affected by his current depressive illness, which is causing him to lack the motivation to comply with any forms of treatments, and also for him to want to engage with the cardiac rehabilitation program, which I think is necessary in this case. So once you've given a good account of what you think the capacity of Mr. Nicholas is, you would then move on to giving a possible differential diagnosis. So the key top differential diagnosis which I would have in mind would be, one, that this is a moderate depressive disorder. Two is that it could be acute stress reaction or an adjustment reaction. Next, you would then move on to the fourth point, which would be explaining to the consultant about what your management for someone with a myocardial infarct and a depressive disorder would be. And you would want to use the biopsychosocial approach, tailoring it to the short-term, medium-term and long-term management. In a nutshell, the biological investigations and management would be doing further blood investigations to exclude any other causes of a depressive disorder. So you would want to do your routine blood investigations like full blood count, UNE, thyroid function, liver function tests. You would also want to do some depression rating scales like MADRS, HAM-D to assess the level of his depressive illness. You would also want to look at managing the risk factors, which would include, as we mentioned earlier, was looking at his diet, number 1, 2, level of exercise, 3, whether he's smoking and tackling a smoking cessation program, 4, whether he's drinking alcohol, and 5, looking at any stressful factors that could be aggravating the situation. So once you've established the biological investigations and looking at the risk factors, you could suggest that the pharmacological management would include the use of an antidepressant. You could further explain that the studies and the recent evidence shows from the SADAT trial that sertraline is mostly indicated for treatment of myocardial depression. You might also want to talk about drug interactions if the consultant inquires about this. Thereafter, you would want to discuss what the psychological management would be in more medium and long term. This would be looking at doing a form of cognitive behavioral therapy, and more specifically tackling the insight motivation in order to improve his compliance and engagement with the cardiac rehabilitation program. The social aspects of care, which would conclude the management, would be looking at his current social circumstances in terms of his family life and relationships, and looking at his work. This would then bring us to the final and last step of highlighting the risk issues and emphasizing the importance of therapeutic alliance. I think this is a common station which comes out because the evidence out there suggests that a person presenting with a post-myocardial infarct has a 3 times higher risk of developing a depressive disorder and thus an increased risk of suicide. So it is important to treat this depressive disorder in order to ensure this patient's well-being and recovery, and to minimize the risk of mortality in these cases, which can be severe. The other thing I mentioned was emphasizing the therapeutic alliance, which in the long run would be beneficial for this patient in order to improve his attitude towards his illnesses and to improve his insight and motivation. So in a nutshell, those 5 bullet points I'll mention again are the points needed in order to tackle and master the station of approaching the management of the post-MI depression station. So the bullet point 1 is to give a psychiatric formulation. 2 is to highlight the capacity issues. 3 is to give a differential diagnosis. 4 is to explain your management using a biopsychosocial approach, and short-term, medium-term and long-term management included. And the 5th and last point is to highlight the risk issues and the need for therapeutic alliance. I hope that by the end of this tutorial you would have mastered the technique for this station, which actually, once you've gone through each of the points discussed systematically, is not a difficult station if you understand the key points that are needed to be conveyed to the consultant. And as I've mentioned earlier, candidates, this is a standard approach which you could use to adopt the structure which you've learned in the station to any other management station of explaining to a consultant. I hope that this tutorial has been helpful, and I thank you once again for listening to this tutorial. Thank you.